Okay, they may also have diarrhea, flatulence, diagnosis. We can look for abnormal pancreatic enzymes on blood work. Usually the CBC is normal. So the best thing about this is we can replace digestive enzymes. We can actually give them a supplement with every meal, and that will help them to digest their food. So it is possible that we give them. So just supplement pancreatic enzymes with each meal. There's a few different options here. They're just brand names. Pancrazyme, Viacase. These are supplements. Feeding a low fiber diet that doesn't have a lot of fat in it can also help. Doesn't have a lot of fiber and fat in it can also help. Exocrine pancreatic deficiency, unfortunately, is irreversible. So you do have to do this for life. For life, they're going to have to be on this supplement. It can be expensive if you have a big dog because the supplement is based on weight. Like it'll say, for a small dog, feed a teaspoon per meal. Large dogs, it might be like 5 teaspoons per meal. So it could be expensive, but hopefully the dog will start gaining weight, stop diarrhea, and make a, maybe not a full recovery, but they will have a nice healthy life after that. The next disease is called, now we're moving on to the rectum. You didn't think there were a whole lot of rectal diseases maybe, but here we are. A perineal hernia. Look at this. This is the back of the dog. This is a big old mass in the back of the dog. The tail is up like this. A hernia is like a hole or a rent in the soft tissue around the anus, and sometimes the abdominal contents get stuck in there. So what this is full of is abdominal contents, maybe intestine, maybe bladder. So there's a reducible swelling. Reducible means we could push this back in. We could go
So is it like that? Prolapse?
Yes, very similar to prolapse. Tenesmus, they may feel like they have to go all the time. That's because their intestines are sitting here in this sac. They may have difficulty defecating. They may even have difficulty urinating if the bladder is stuck here. Rectally palpating will palpate this. So a perineal hernia. If they have a hernia, we do need to surgically repair this and castrate the animals because this is most common in male dogs that are intact. Sometimes they say it has to do with hormones, and because of the hormones they may have this. So castrating them and surgical repair. If they can't defecate, then stool softeners and enemas will help. Stool softeners and enema. And then for client information, keeping the stool soft may help to reduce the straining, and castration is recommended because testosterone may predispose them to weak anal tone and cause a hernia. So castrating them is...
Does that happen a lot?
No, I can't say it's super common. Can't say. I'm trying to even remember if I've seen an actual one or if I've just read it. Here's a perianal fistula. So what this is, it's around the anus, perianal. Fistula is a draining, like an abscess essentially. So what happens is around the anus, it gets infected. Okay? So it starts usually as some kind of inflammation or infection of the oil glands around the anus. Bacteria grows. When the bacteria grows, it creates pus and abscesses. Those abscesses rupture, and then what we get is a leaking of pus around the anus. It ruptures open. We have leaking of blood, leaking of pus around the anus. So it's going to be painful. Sometimes they'll leak stool. Sometimes it'll bleed. It'll be a foul odor. It's just like having an anal infection. German Shepherds are dogs that tend to be really predisposed to this problem. How do we diagnose it? Really just physical exam, and we treat it by clipping the hair, keeping it nice and clean, putting them on antibiotics, and then if there's dead necrotic tissue, then we have to do surgery to remove that infected tissue, to cut away the infected tissue. And we can do that either by cutting it away, burning it away, freezing it away, but you have to get rid of the infected tissue. Cryosurgery is cold. It's like freezing it off. Cryo. Laser surgery is just using like a high frequency, like an infrared light to cut. Cautery is more like burning it off. It's like just burning off the dead tissue. But you remove the infected tissue, put them on antibiotics, realize that they're going to be painful, so let the clients know the dog's going to be painful. Try not to mess with them around their rear end. Be cautious that they could try to bite you if you do. They could leak feces. Part of the reason is it may be painful for them to control the sphincter, and so they might just leak feces all the time. Anal stenosis could happen. Anal stenosis is where the anus heals and it scars down really narrow, and now their anal opening is not very big. So that could happen later on. Anal stenosis.
What is dysphagia?
Difficulty defecating. And the final one is called perianal gland adenoma. This is a tumor of the anal glands. Tumor of the anal glands. Usually these are benign. Usually these are benign tumors, but we might notice them because there's going to be masses right around the perianal area. Okay? And sometimes they're itchy, sometimes they bleed, sometimes there's nodules around there. So if they have tumors of glands around the anus, the best thing to do is to take a sample of it and biopsy it and then remove those. Surgical removal. If they are cancerous, radiation therapy may help. Again, cryosurgery, kind of cutting them out with a cold laser. Castration. If we can castrate them early, sometimes the tumors may go away. This also has to do with hormones in the males. Gently cleanse the area. And again, if you castrate dogs at an early age, they're going to be less likely to get perianal gland adenomas. It's more common in the intact males as they get older. Intact males as they get older. Okay? So that's a perianal gland adenoma. Okay? Questions about that? You can cut.